explain kind of what complications can arise with having some of those high platelets, such as clotting or, risk of some of those really high risk events?
Yeah, sure. So patients with ET are at risk for having both blood clots and also, almost confusingly, having bleeding. So the platelets are the blood cell that are responsible for helping us to clot if we cut ourselves. And so one of the things that we worry about, certainly when we have too many platelets, is that patients will be at increased risk of blood clots. But sometimes when patients have really high platelets, especially if they're over 1 million or 1.5 million, patients are actually at higher risk of having bleeding as well. And so either of these conditions can occur. And I think important to note, we don't usually make a decision to lower patients' platelets because they're elevated. We usually make a decision to lower patients' platelets, taking into account several other factors that may increase our patient's risk of having a blood clot. So depending on the type of mutation that a patient has, their age, their cardiovascular risk factors, and if they've had prior blood clots before, all of those things get weighed in together to decide if a patient needs to be on a medication to lower their blood counts or not.
Okay, and I know you mentioned kind of progression. Can you explain, maybe give us an idea of what percent of patients do progress to myelofibrosis or to a post, ET-AML, just to give us a better idea of the risk there?
Sure. So of all the myeloproliferative neoplasms or MPNs, ET is usually the condition that's associated with the lowest risk of progression. So patients with ET will progress to myelofibrosis around maybe 10% of the time, and really it varies also by mutation. So patients with what's called a type 1 calreticulin mutation are probably at higher risk of having progression to myelofibrosis compared to patients with a JAK2 mutation. And thankfully, progression to acute myeloid leukemia is very infrequent in patients with ET, occurring in less than 3 to 5% of the time. Now, the progression that's most common is probably something that's not even actual progression. It's more like living along a disease spectrum. And that happens more frequently, and I don't have a specific number, but sometimes patients are diagnosed with what looks like essential thrombocythemia. And then over time, their blood counts kind of evolve a bit. And really what they end up having is more a condition called polycythemia vera, or PV. This is something that really only occurs in patients that have a JAK2 mutation, where initially earlier on in the disease, they have higher platelets, and then over time, not only do they have high platelets, but their red blood cell numbers may go up. And we see that fairly frequently.
As we talk about progression, why is it so important for patients to track some of those symptoms that you discussed before and make sure that they're telling their provider of any new symptoms, or if they're, increasing in frequency or happening a little bit more?
Yeah, so having a symptom and having a new symptom is not equivalent to having disease progression. But if you have symptoms that are attributable to your disease, it is important to talk to your doctor, because there may be medications that can be given to help improve those symptoms, which is really important. I mean, I think a really important part of caring for patients with essential thrombocythemia is to also help them have an excellent quality of life. Now, there may be some symptoms that we definitely want to hear more about, because those can be associated, not always, but sometimes, with disease progression. So if somebody with ET is really developing an enlarged spleen and it's growing quickly, and that comes with fevers, night sweats, and unintentional weight loss, so not weight loss that's on purpose, those are symptoms that do raise the alarm a bit more and make us wonder if that patient is progressing to myelofibrosis. And so it is really important, I think, to communicate with your healthcare team so that they know about those symptoms, and perhaps check blood counts to see if another treatment is necessary.
And Dr. Hobbs, what really lifestyle changes can patients make to, whether it's staying active, diet, managing some of those cardiovascular risk factors that help with managing their ET?
Yeah, that's such an important question. I think that having a diagnosis can be really difficult for patients, and modifying or being really mindful about managing a patient's lifestyle can really help in many different ways. The first is to give patients control back, for them to really feel like they can be in control of their disease, And for ET in particular, I think this really, really matters. So when I think about the MPNs or ET specifically, I think about it as an additional cardiovascular risk factor. What is a cardiovascular risk factor? Things like high cholesterol, diabetes, and high blood pressure. And these are things that when you go to your primary care doctor, they make sure that they're well controlled. And so for ET, I think that managing all of those cardiovascular risk factors is really important. And I will give you the same advice that you're likely to get from a primary care doctor. So being active, any form of activity, whether that be yoga, going to the gym, getting on a treadmill or a stationary bicycle, or going outside for a walk, any type of movement I think is really important because that keeps your cardiovascular system healthy. It's good for controlling all these cardiovascular risk factors that we were talking about, like high blood pressure, diabetes, et cetera. And it helps us also achieve a healthier weight. And then along those lines, a question that I get all the time is, what should I be eating? What are the foods that I should be eating for my MPN? There's not an MPN diet. There is the diet that is recommended for every patient, and especially those with cardiovascular risk factors. And that is a diet where we minimize processed foods, minimize processed meats, and having more fruits and vegetables and more of this Mediterranean or whole foods diet is, I think, really important. And it's not just a diet that's for MPNs. It's really a diet that's associated with improved cardiovascular endpoints. And so these types of diets have many different names, like Mediterranean, whole foods diet, plant-based. All of those things are really talking about the same thing: less saturated fats, more plants, and less processed foods.